So my role as an orthotist involves doing all external devices to the body. So we do everything from helmets to spinal braces to leg braces and everything in between really. I came to the role because I wanted to do something medical. I wasn't really sure what. I didn't want to necessarily follow the standard routes of physio and radiography. So I was just looking at my options and almost stumbled across this. So my day can be really varied. Generally, I'm in an outpatient clinic for the majority of the time, and that might be for an assessment, it might be for a casting appointment, it could be for a supply or a review, and then I spend the rest of my time seeing inpatients on the wards. We work with a really wide variety of communities, everyone from children right the way through to adults and older people. There isn't really any communities we don't work with. Lots of different communities need orthotics in all sorts of different ways. So we work with a lot of other professionals within the hospital in multidisciplinary teams. We regularly hold clinics jointly with physios of different departments, so paediatric physios, neurological physios. We have clinics with the orthopaedic consultants. And so even if we're not in clinic with them, we're always sort of liaising with different clinicians to get a whole team approach to ensure the best care for the patient. Our work benefits people with learning disabilities. We work with them to assess their mobility and their needs and work to sort of assess for and provide devices to improve that for them. So whether that might be that they may have, say, epilepsy or self-harm and they need a helmet to protect their head from injury, to they struggle with their mobility for varying reasons, and we would assess and supply them devices to aid their mobility. So I think with the learning disability community, it's just taking time to work with them. Obviously they need longer in clinic, so to ensure we have that additional time to really allow them to communicate with us. Like, I would always ensure that they see the same clinician again, so I would go ahead and rebook them with myself to ensure that that rapport is built, because we build such a good relationship with the patients because we're seeing them like every few months or on a regular basis, and so having that ability to get to know them really well. I really enjoy my role. I think the variation of our patient group and also the variation of what we do day to day. Because we see our patients regularly, because they have devices supplied with us, I really enjoy the rapport I build with patients.